welcome Dr. Akbar Bayat. He's a board-certified ENT surgeon, fellowship-trained head and neck surgeon working in a private hospital in Tehran. He's going to talk to us about modified scalp preserving coronal forehead lift.
I'm talking about modified coronal lift that specifically considered follicular bank preservation. Forehead lift can be done by endoscopy, and in most of the cases we can get good results. But in some patients, when we want to have a bone contouring or when we want to do surgery in thick skin patients, it may be insufficient, and we may use classic coronal lift. In classic coronal lift, we routinely resect a strip of scalp that has many follicles at the end of the surgery, and if we calculate quickly, when we have a density of about 200 to 250 per square centimeter hair density in the scalp, we resect about 20 square centimeter of the scalp. That means we eliminate 4,000 to 5,000 hair follicles at the end of the surgery permanently. So we redefined our surgical goals to preserve the hair follicles without compromising the lift result and having full access to the bone contouring. How do we achieve these goals? Classic coronal lift is based on the dissection in subperiosteal plane, and if you see, you can see the movement of the soft tissue over the periosteum more than some centimeters without moving the periosteum. So at the end of the surgery, the soft tissue can glide over the periosteum and can result in the reduction of the last outcome. So to get these goals, we use two complementary strategies: dissection strategy and fixation strategy. Dissection strategy consists of two different methods, two different techniques. The first technique is changing the dissection from subperiosteal to subgullion. This can help us at the end of the surgery to reduce the gliding effect of the soft tissue over the periosteum. And second technique at the end of the dissection in subgullion, and second technique in dissection is dissecting the posterior flap in subgullial plane to reduce the force of the posterior flap in the incision line to migrating the incision line more anterior. In fixation strategy, we can use three different techniques. These techniques are used different type of sutures. The first suture technique is target-based sutures that suspend the desired point of the eyebrow to bone tunnels and deep temporalis fascia. The second type of sutures are multiple sutures that fix the flap to the deep fixed fascia and periosteum. This can help us to reduce the dead space and share the mechanical load of the soft tissue between sutures. And the third technique of suture is a suture that fixes the galea to the underlying periosteum at the incision line. It helps us to prevent anterior migration of the incision line after the surgery. And at the end of the surgery, you may feel some movement in the scalp, but it will be gradually within 1 to 2 months will be fixed without migration of the incision line. We did a study over on the 40 patients. Most of them had bone contouring and follow up for 18 months. They have very high satisfaction and stable result after 18 months. You can see some results. A stable result. The complication of modified scalp preservation for head lift is the same as classic coronal lift, but we can preserve the hair follicles, thousands of hair follicles. On open coronal brow lift, open coronal brow lift may be necessary in sometimes, and it's not outdated. And we can preserve the hair follicle without compromising the result, and really follicular preservation matter. Thank you for your attention.
Thank you very much, Dr. Akbar, for a very nice presentation.